This is our group project, Blood Typing and Transfusions by Isabella, Raphael, Hayden, and Meg. The first topic that we'll be talking about is topic A, a transfusion of whole blood between compatible blood types. A blood transfusion is when one person gives blood to another. This could be done for multiple reasons. One reason is if someone has a serious injury or is in danger of death or internal bleeding. In extreme cases, you could have a blood transfusion for physical exhaustion. Blood transfusions were first discovered in 1654. You can give blood to yourself if need be before a surgery. Blood is made up of several parts, including red and white blood cells, plasma, and platelets. A blood cell transfusion may be used if you have anemia or an iron deficiency. Platelets are tiny cells in the blood that help you stop bleeding. A platelet transfusion is used if your body doesn't have enough of them, possibly because of cancer or cancer treatments. A plasma transfusions help replace the protein in your blood that can help it clot. It may be needed after severe bleeding or if you have liver disease. If a blood transfusion was successful, the antibodies will not attack the new blood given to the host.
The next topic we're going to be talking about is a transfusion of whole blood between incompatible blood types. If incompatible blood is given in a transfusion, the donor cells are treated as if they were foreign invaders, and the patient's immune system attacks them accordingly. Not only is the blood transfusion rendered useless, but a potentially massive activation of the immune system and clotting system can cause shock, kidney failure, circulatory collapse, and death. The key to incompatible blood typing is antibodies, which are the body's proteins that act as the immune system and antivirus protector. Antibodies act as the body's identifier in finding something that does not belong. When speaking about antibodies, it is important not to confuse them with antigens. However, antigens are any type of molecule, such as a carbohydrate or a protein that can be recognized by the immune system. Antibodies do target antigens that come off as invaders. This is important because if the wrong antibody is introduced that is not normally there, the body sees this as an intruder and will immediately send out the first line of defense, which is more antibodies, to fight off these invaders, which in this case would be an incompatible blood.
An example of a transfusion of whole blood between incompatible blood types. So this specific example would include a cause of a patient coming into the emergency room with a lacerated femoral artery. This includes a broken femur. This patient has already lost 2 liters of blood. This is increasing rapidly. Their blood pressure is dropping and you have to act fast. The patient is a blood type O. The patient is a recipient of a transfusion and receives blood by a type B donor. Note, the recipient does not have any A or B cells. The effect of this would be that the patient's body's immune system identifies the foreign bodies of the blood and immediately goes haywire, trying to destroy the unfamiliar cells. Doing so, the patient's BP is rising rapidly, thus showing signs of shortness of breath, fever, chills, and low back pain. Looking on the cellular level, what is happening is the binding of foreign antigens to the surface of the red blood cells, resulting in cells rupturing and entire destruction. In some situations, rejected blood can be filtered out by the kidneys, but larger transfusion amounts could cause kidney failure and potentially death. Therefore, when participating in any blood transfusion, be sure to know both the recipient and the donor's blood type.
Now let's talk about a transfusion of compact red blood cells. This is something you would do if a transfusion of whole blood was incompatible. Packed red blood cells, also known as PRBCs, are made from a unit of whole blood, which then is put into a centrifuge, and most of the plasma is removed, leaving a unit of hematocrit of about 60%. One PRBC unit will raise the hematocrit levels of a standard adult patient by 3%, or about 1% per milliliter per kilogram. In a child, it will raise it 12% per 25 kilograms. A standard unit of PRBC is about 300 milliliters. PRBCs are really important because they replace your red cell mass. So when your tissue oxygenation is impaired by something like acute or chronic anemia, you use PRBCs to replace those red cells that have been damaged, and that in turn will increase the amount of O2 your body is able to intake.